Multiple myeloma is the second most commonest type of blood cancer. There are 24,000 patients with myeloma living in the UK. It's typically a disease of older adults, but 1 in 4 patients are diagnosed under the age of 65. There have been a number of breakthrough treatments in myeloma. Although it still remains an incurable blood cancer, patients are living longer. I'm Professor Ashutosh Wechalekar. I'm a professor of medicine and hematology, and I'm here to talk to you today about CAR T-cell therapy, which is a novel breakthrough treatment for multiple myeloma. Myeloma or multiple myeloma is a type of blood cancer. It's a cancer of a type of immune cell called plasma cells. Plasma cells have a normal function of helping us to fight infection by producing antibodies. When these cells go rogue, they become cancerous and cause myeloma. These cells live in the bone marrow, and therefore, as the cancer grows, it can affect the functioning of the bone marrow. The cancer cells can damage the bones themselves and raise serum calcium levels. The protein produced by the plasma cells can affect the kidney function. Myeloma is treated by a combination of chemotherapy, immunotherapy, and stem cell transplantation for selected patients. With newer and better therapies, we can achieve deep responses in patients with myeloma, which can last for months or years. The disease almost always relapses and requires further treatment. The disease gets more and more resistant over time, and we have got newer therapies such as bispecific antibodies, which activate your own immune system. But more recently, we have got targeted therapies like CAR T cells, which can give deeper and longer remissions. CAR T cells, or chimeric antigen receptor modified T cells, are a new type of immunotherapy for the treatment of different types of blood cancers. CAR T cells are one of the first type of personalized individual treatment for blood cancers. We take your own T cells out, we then grow these cells so that these are expanded outside of the body, and then these are reinfused back to a patient, very similar to what we do for a stem cell transplant. Here we just give your own engineered T cells back. These T cells will then find their way to the cancer. They will grow, target the cancer, and kill the cancer in a very directed way. In lymphoma and leukemia, 2 other types of blood cancers, CAR T cell treatment has been incredibly effective and even potentially curing some patients who a few years ago may not have had a treatment option. We now have availability of CAR T cells for multiple myeloma, and patients who have relapsed after many lines of treatment, we can get deep and prolonged remission. It's an incredibly exciting time for patients with myeloma to have access to this novel therapy. As a physician treating myeloma patients for many years, this is probably the biggest step change in myeloma treatment that I've seen in a decade. It is a unique personalized therapy that offers options for patients who have relapsed after many treatments where we may not have had treatment choices before. What we can also see is that it's a therapy which can be given as a single treatment, and patients often don't need treatment after completing the CAR T-cell treatment. At present, it's being used for patients who have relapsed after many lines of treatment, but recent clinical trials mean that we can use this therapy much earlier in the disease course with less side effects and better responses. It's an incredibly exciting time for us and for all the patients to have access to this therapy for myeloma.